Well, welcome everyone to the first of several discussions this joint group of Democrat House and Senate members plan to have to discuss the very important Affordable Care Act. With the Affordable Care Act, Indiana has a great opportunity to increase access to quality and affordable health care for many thousands of Hoosiers across our state. The Affordable Care Act also affords Indiana a means to drive down health care costs and improve our economy. Yet, to our dismay, there have been no legislative discussions, no public dialogue on the establishment of our state's program or its implementation. This silence is deafening to us and detrimental to the many Hoosiers we represent. So today, we want to jumpstart the conversation and engage Hoosiers in this very important health care discussion by introducing a bill that begins to address the Affordable Care Act in Indiana. To further discuss this bill is the bill's author, Senator Karen Tallian from Porter County, Indiana.
Thanks, Jean, and thanks everybody for coming this morning. Yes, I filed this bill, but I do want everyone to know that this has been a joint effort with the House Democrats and with the Senate Democrats. A lot of help from Charlie Brown and Ed DeLaney. The bill has two parts, so I want to talk first about the insurance exchange. Simply, the bill constitutes a new committee that would oversee the implementation of the Affordable Care Act. It directs the Department of Insurance to come up with a plan for an exchange and to bring it back to this group sometime by next summer and have everybody sort of sign off on what that exchange is going to look like. We've set this up, or the federal government has set up a program that is not a lot different from a lot of other things that we've done in this country. Certainly when we first passed the Medicaid program, states were given the ability to join or not, and although it took some kicking and screaming and many years, every state in the union now participates in a Medicaid program. And certainly even in this state, we have a similar concept with EPA and IDEM. States were given the opportunity to create their own environmental protection agency, and I don't think anybody in the state of Indiana would now suggest that we get rid of IDEM and let EPA run our environmental programs. So we need to get on board with setting up this exchange, even if we're not meeting all the time deadlines that were originally set out in the ACA. We need local control, and participation in this is inevitable. So the second part of the bill is the expansion of Medicaid. I hesitate to call it Medicaid expansion because the program really is a different and new program. I would rather think of it as healthcare expansion for low-income workers. It's not only fiscally sound to do this, but I believe it's fiscally irresponsible to not do it. We know that, even Milliman has projected that there would be 400 and some thousand people that would be added to the rolls and become insured under this expansion. Direct federal money coming to the state of Indiana over the next, some people have done 10-year lookouts. We're working on kind of a 7-year plan. But the direct federal money to come to the state of Indiana in the next 7 years is expected to be at least $12 billion in direct aid. And we have provided, I think it's available to you, a summary sheet. Elise is passing them out now, showing what the potential costs would be, and comparing it to potential revenue offsets, where that we will not have to spend money in other programs. One of the things that you're going to see in this sheet is that we have not included, as part of the cost here, what has been referred to, unfortunately, as the woodwork people. I find that term particularly annoying. These people are currently eligible but unenrolled, people who could be participating in Medicaid right now. Milliman has estimated some 92,000 people. I believe we're taking that number for the purpose of our estimate. But the reason that we have not included them in this right now is because they are already included in the new budget proposal in terms of Medicaid expansion and the Medicaid forecast. So it would be wrong to include them twice. So what we're looking at in this sheet is just the extra cost of expanding Medicaid to the 133%. And as you can see, you know, we don't go negative in this scenario until at least 2020. And we may not even go negative then, because we are identifying, as we go along, additional cost benefit or cost savings in a number of different areas that have never really been discussed by the Milliman program. And I don't want to get too far into the weeds in that, but we've got several examples listed on the bottom, and I think one of the most important ones is the cost savings to the Department of Corrections. We currently have a line item in the budget of $100 million a year for medical, to provide medical benefits to inmates. Those people did not previously qualify for Medicaid because of their status. They now will qualify under ACA. So we know that we can save a lot of money in several other areas, and we're looking through those right now.